Do you struggle to create short-term and long-term goals that are realistic and achievable for your cash pay patients? If you do, this video is going to be perfect for you. My name is Garcia. I help cash-based physical therapists improve their clinical outcomes and succeed in their business. When we look at creating goals, a lot of times cash pay patients they want to be able to achieve functional goals, right? So you create a 6-week walking goal, you create a 12-week return to the gym. And while these were great inside an insurance-based setting, they're not going to be okay in a cash-based setting. And the best thing you can do is forecast forward. And this is very foreign for a lot of physical therapists because we've never had to deal with this. You were given a short timeline. So meaning in an insurance-based world, you were given, 6 weeks, 8 weeks, or 12 weeks to be able to help somebody accomplish something. So it was a fixed timeline. So the insurance company and maybe the physician gave you the end time, right? This was the end goal. And that was easy for you. You're like, well, I only have 10 weeks to work with this. This is what I have. In a cash-based setting, you have a patient who has asked, I have a target. Can you achieve this? And they might say, well, it's 4 months, 6 months, or I don't have a target, and you're stuck. And you're wondering, okay, well, in insurance, I was given these short timelines or given these allocated times, but now I'm in freedom world. I don't know what to do next. How do I create the best goals to be able to help my patients? And I hear this all the time. It depends. It's per patient. This person's history is different than everyone else that I've seen. If that's a framework that you're using, you're already in the wrong spot. Where you need to start is by projecting forward based on normal healing timelines. You know this from PT school. You know this from your clinical practice. It's going to take 4 to 6 weeks in any physiology, working with any patient within reasonable ages to be able to achieve 4 to 6 weeks of neuromuscular control. That is a normal adaptation period. That's the first phase. In the second phase, it's going to take you 4 to 6 weeks to develop strength on top of their neuromuscular control. That's just normal healing timelines. That's why you usually see people for 2 to 3 months. Why? Because it's going to take you 6 weeks to get them better control, 6 weeks to get them strong, and that's when they go back to sport, they do their things. But the problem becomes when you work with cash pay patients, you suddenly forget about those timelines. You don't think about normal healing. You let that person tell you their story and how they're different and their physiology is different. And when in reality, most people in pain management, assuming non-severe chronic pain, follow these healing timelines. So if you're wondering how to create targets, how to create goals, just use this framework. The next question is, what if they want to return to sport? You still use the first 6 weeks, neuromuscular control, the next 6 weeks of strength. From there, then you do integration into plyometrics, which is going to take you a 4 to 6 week block, and then return to fitness, a 4 to 6 week block. So somebody might not be able to go return to sports, especially after a significant injury, until month 4, probably to month 6. That's why surgical timelines are the way that they are. And for some reason, you don't apply that anytime that you're inside working with patients who are non-operative. And a cash pay patient is asking that same question, how long is this going to take me? Well, I don't know if 3 months is enough for me. That's a better conversation to have. But first, you have to be able to forecast. If you can't create these goals and targets, there's no way that this patient sees a value in what you're doing. So if you're stuck trying to create targets that were used in insurance-based care, be able to get range of motion better, impairments better, walking better, going up and down stairs, that's going to be great for your first 6 weeks. But in order to take them to that next level, and it's probably why you got in the cash-based setting, you need to get them at least to that 3-month mark, and then from there, take them on to strength and conditioning. Now you have to tell the patient this. This is a missing gap, the missing barrier. Anytime that you're working with cash pay patients, you fail to tell them what's in your brain. What you need to do is set this expectation and lay it down from the very beginning. First 6 weeks of our care together is going to be based on getting everything mobilized, getting you more mobile so you understand what the next phase is. And then we're going to get you strong. After that next phase, we're actually going to return you to soccer. That's going to take me 4 to 6 weeks. After that, we're going to get you in practices, returning to sport, cutting, doing those drills. So that's the 4 to 6 month timeline. From there, we can work backwards and manage any hiccups or anything that you do. If you forecast like this, that patient now knows, I'm going to be working with this person for up to 6 months. It helps them identify where they're going to get stuck. And that's assuming everything worked out perfectly. Now that puts everything onto the patient's hands and gives them the best chance for success versus going week by week, them questioning, can you help? Do they know what they're doing? And now that puts you in a position of, does this patient even trust me? Will they come back? So if you're trying to build loyalty with easy to understand goals that are short-term and long-term. Stop using it's a per patient, thing. This person's so different. Their physiology is different. This knee pain is different. Why don't you just take it to the fundamentals of science and healing and understand normal tissue healing guidelines and let that dictate what your plan of care should be and how this person's going to heal. It takes the pressure off of you, allows them to understand their normal healing process, how their cells are working, and it allows them to have control over their plan of care and their health, and instead of relying on you for every single phase. That will help take the pressure off of you and create success with the patient outcomes that you're looking for. Implement this with every single initial evaluation, and even if you have people you've been working with for weeks to months, you can still use this. Let them know, be honest. I'm trying this new style of progressions. I know we've been working together, but I really think it's the next step. The more honest you are, the more willing they'll be to accept it. And once they start seeing those progressions, they're starting to ask, instead of what are we doing today, it's, hey, I'm getting really close to that timeline. It allows them to understand where they sit and how far they need to go to achieve that next milestone. So if you're a cash-based PT owner and you're looking for more ways to help your clients and your patients be more successful and independent, this is the route that you need to go. Enjoy. Hi, if you found this video helpful, please give it a thumbs up. Don't forget to subscribe and hit the bell notification for my weekly tips on treating cash pay patients, becoming that expert in your community, and thriving in business. Thanks, and I'll see you soon.